I was turning about 26 years old. I met a lady who had just been seriously beaten by the husband after 26 years of marriage. And they're from a very, affluent family. And that's when it hit me, oh my God, she's been married for all these years that I've been alive, and she's just been beaten. Volunteerism also gives you the experience, and that's what people miss out, that you don't just wake up and be where you want to be in 5-10 years. That particular day, Alberta, I had poison in my back. I was waiting just to be told that I'm HIV positive and I'd end my life.
Hi everyone, my name is Rachael Mwikali. I'm the Executive Director, Coalition for Grassroots Human Rights Defenders Kenya. I also sit in the Youth Sounding Board for the Royal Danish Embassy here in Kenya, and then also the Global Board where I advise the Minister of Development Cooperation for Denmark. I'm joined by a sister, a woman human rights defender, who is the Executive Director for Gender Violence Recovery Center, Alberta Wambua.
Thank you, Rachael.
So could you please, Alberta, tell us how you got into this work, from where you started, and how did you gain the passion around ending gender-based violence?
Mm-hmm. Thank you. I guess the passion for humanity or working with people started way before I joined the organization, because then my basic degree is on social sciences. So how I joined, I had just finished campus, took some 2 years, had my first baby, was a stay-at-home mom. And then one of these times you say, oh, let me get something to do. And joined as a volunteer in providing counseling to survivors of gender-based violence. And while in the sessions, I think that's where the turning happened, So did volunteer for about a week, then got employed as a counselor. And at that particular time, the Gender Violence Recovery Center was just in one hospital, that's Hurlingham. It now has 8 centers. Those are 8 gender violence recovery centers. And through those sessions, there was a lot of, let's say, connection with reality, because then you'd find a child who's been defiled and those transference. So you'd see your child in it. There's a time, I think, I was turning about 26 years old. I met a lady who had just been seriously beaten by the husband after 26 years of marriage. And they're from a very, affluent family. And that's when it hit me, oh my God, she's been married for all these years that I've been alive, and she's just been beaten. So a lot of that and what used to happen made it very real. And lack of a better word, it became an addiction. Addiction in that you tend to think, can I get out of this space? But there's a lot of trauma, lots of trauma. There's lots of stress around it. And there's a lot of learning, because then with time you also have to detach yourself from the work. Otherwise it affects your personal life. So through those experiences, through being there, and there's a lot of satisfaction. I meet a client, for example, in one of those sessions I'll never forget. And she came for her second session, as she had been raped, and she came for a second session. And in those sessions, you also have to disclose the HIV status. You disclose it after the second session, she goes, and the next time she comes, the third time she tells you, that particular day, Alberta, I had poison in my bag. I was waiting to get, just to be told that I'm HIV positive and I'd end my life, So there are many experiences and many survivors I've met. And what happened is then, as I said, becomes like an addiction, and you can't stop, because then the satisfaction, where you meet women who are raped, and then you have support group sessions, you have group therapies. At the end of about 10 months, 11 months, someone tells you, I'm much better. And then after a few years, they invite you to your wedding. Yes, earlier, they couldn't even stand men, So seeing how survivors' lives are brought back to normalcy, which is a purpose that the Gender Violence Recovery Center has kept me going. And through that, then I've been able to rise in about 6 positions to be the executive director. So what I must say, the passion then, I think, comes from the satisfaction you get. The difference you make in people's lives. Trust me, a lot of times I'm almost giving up. A lot of times, let's make this conversation really raw, but you have to put this strong face. And sometimes you're like, okay, if I don't assist this client, who will? you know, and lots also of conversations when you meet the survivors when you go across Kenya and someone tells you, you know, you made a difference in my life. Or you're going for a certain talk and you walk out and someone says, your organization saved me this day and this day. And I keep saying, and I keep also telling my board of trustees, how we make it in this life, I think it's the prayers of those survivors thanking God for it. So that's why I'm still here. The fact that I volunteered put me in the right space to be able to, you know, we have to be ready when the opportunity knocks. Volunteerism has that, it gives you that sense of humanity and gives you that satisfaction. But volunteerism also gives you the experience. And that's what people miss out, that you don't just wake up and be where you want to be in 5-10 years. There has to be a lot of putting yourself in that environment, understanding that context, and that can also then come through that volunteer work. Volunteerism also puts you in touch with reality. Don't believe it, but in my other personal space, I still volunteer and still do community service, you know, and a lot of it just beyond also what I do at my workspace. So for me, volunteerism is very important. It actually, we would think that a lot of times we think it benefits the other person or the community, but I find the benefits to self much better.
A lot of cases come to you and not to public hospital as GVRC. Why do you think people trust GVRC and not mostly public hospital, which should have been the opposite, that people are going more to public institution and not private? Why do people trust you more as an institution?
I'd say there would be a couple of reasons. So one being a center that started in 2001, when there was no gender-based violence response services at other government facilities. Interestingly, GVRC started more on medical treatment and psychosocial support for about 2 years when it started in 2-3 years when it started in 2001. And when it started, it was started at the Nairobi Women's Hospital, and they thought that it would be just 1 or 2 clients of rape. Actually, it was specific to rape. But interestingly, those 3 years, about 3,000 survivors of gender-based violence. So what I would say, being 24 years old, survivors then being the only place that could get support started coming to GVRC. Over the years, GVRC has learned, you know, from experiences, you know, from mistakes, from lessons learned in terms of gender-based violence. And it's been key in the country in shaping how response is done in Kenya in terms of gender-based violence. So, for example, clinical, regimes in how you manage gender-based violence, for example, you know, defined from the hospital. When you talk about the post-rape care form, that was from a monitoring toolkit, which was a toolkit, you know, done at the Nairobi Women's Hospital, then at scale, or taken to the level of the national level. So from documentation to what is the regime like, to, for example, how are court cases, how do you offer medical expert testimony in court, how do you work around the referral mechanisms, you know, from the health facility to every other service point that's needed. How is the psychosocial support done? So it's not just textbook, it's the practical and contextualized. So over these years and making those fast changes in terms of standardizing and providing quality, which is also comprehensive support to the survivors, there's been that, you know, belief at GVRC. Again, the survivors, the support or the medical treatment, psychosocial support is a not cost to the survivors, but a cost to GVRC, meaning that GVRC would forever fundraise, and Denida has been one of the long-standing partners in providing this support. So having that, program or really well-defined support to survivors, having, for example, doctors, clinicians who are trained on site, because there's very meaningful pre-service training in terms of gender-based violence management. That has also contributed to the quality of services at GVRC. Talk about data management, for example. GVRC is able to tell you that this number of clients, these are the patterns, these are the emerging trends. You know, a lot of times our statistics are actually higher than the national level statistics in terms of gender-based violence management. GVRC has also gone ahead because through the functional referral pathways to also enhance the capacities of different duty bearers, be it at a national level, and that includes setting curriculum. For example, there's a 45-hour curriculum in the in the nursing degree training for nurses. For example, there's training, for different duty bearers, police. We've just trained 360 policemen earlier this year on gender-based violence management from 21 counties with support from the Danish embassy. We have a teachers programs. We have a school program. So what I'm trying to say, as much as you're doing response, and we also do primary prevention and capacity building of service providers, you're also capacity building the ecosystem in terms of gender-based violence management. I would say this is what then has also enabled GVRC to be that trusted to go to GBV Center, or they call it Gender-Based Violence Protection Center, including rescues. We do rescues, we have ambulances, we have temporary shelters, and now we have a shelter component where we're supporting 16 shelters across 13 counties with support from the Embassy of Denmark in Kenya. I must say, through this experience, GVRC then got a GBV model paper that was accepted by government, and then hence a replication of the integrated model in terms of gender-based violence service delivery into other 13 county GBVRCs, we call them gender-based violence coverage centers, which are now in county government hospitals. So what GVRC does, apart from receiving the cases or supporting survivors at the center, because of access to services and timely access to services, we then enhance the capacity of the county government hospitals and set up the centers there, and not just set up, but continuously provide that support.
Because if I can look at Alberta, and I'm happy you've been able to break with different multi-levels engagement on GBV preventions. And there's one point that I would really like also for you to be able to make the viewers understand on how GBV cases are very serious, especially now with the rising cases of femicide in the country. Would you, for example, give us in terms of data, like how many cases do you receive a month? And when you receive these kind of cases, based on also the kind of intervention that you have mentioned, what is preventing government to act? When you have given all the models, even to the duty bearers, even to the government, and I acknowledge and I understand, which also maybe you can talk about it, you're the co-chair of the task force on ending gender-based violence and femicide, and then also the one for State Department. Maybe you can tell us more so about that.
Okay, thank you. So at the Gender Violence Coverage Center, we receive between 350 cases a month to 400. I must mention that is not follow-up cases, because as an outpatient, you'd come for about 6 visits for medical treatment and tests, medical treatment, and a longer about 10 or 12, for example, for one-on-one counseling session and support groups. So when I say 350, I mean what we call new cases, meaning they're coming to the center for the first time. I must say also that these numbers vary. For example, when schools are closed, you'll have more cases, children being abused. When it's towards end months, it's around the festive season, you'd have a lot of intimate partner violence. When you have instability, for example, floods, droughts, you have the COVID-19 pandemic, for example, you'd have more cases and they'll present differently. So around the COVID-19 period, for example, we had the shadow pandemic where we had 4,067 cases in 1 year, and you had 208 teenage pregnancies. Now, normally would have before that, would have about 17, 20 teenage pregnancies in 1 year. Now we have about 88 cases, 90 cases of teenage pregnancies in 1 year. So I just wanted you to understand that the dynamics will also change depending on. Yes, very worrying. Yeah. And those are the reported cases. The Gender Violence Coverage Center is a vice chair through Dr. Sam Denya of the Technical Working Group on gender-based violence, including femicide. This was set up by the president. It was around in January 2025. They're about to give their feedback and report after different consultations across the country and getting different memorandums, including from ourselves, to the technical working group. So that, plus also, GVRC, through myself, also co-chairs the National Gender-Based Violence Sector Working Group and the State Department of Gender and Affirmative Action. And there then, on a monthly basis, would have meetings. On a biannual basis, would give feedback to the CS for gender. and in terms of what exactly is happening, what do we need, what do we need to change, and things like that. And it also brings state and non-state actors who are able to put the synergies together and shape in terms of prevention of gender-based violence, but also response in case there's violence. So that also then feeds into your question you asked earlier, what's the government doing and what are we doing? So through ourselves and the different partners and through the expertise we have in-house, either through these two different spaces or any other spaces, because then we're part of court users committees, we're part of county technical working groups, we are called, for example, to feed into different studies. For example, there's just one recently by the National Defense University of Kenya, where they're doing a study on femicide. So we're able to give feedback because then we have direct interactions with the survivors of gender-based violence, and we're able to share, and we have interactions with them, not just one-off, but really in deep conversations. So we are able to share, of course, with shared confidentiality, what exactly is happening. I'll give you an example. Yesterday, we were having a team meeting, and one of my colleagues from Mombasa was saying, Alberta, there's a certain area in Likoni where there's a lot of gang rape. We're receiving a lot of gang rape cases. So we're able to give feedback to the county commander of Mombasa and to the OCS there and say, there are gangs here, 7, 8 men, raping women. You need to do something about it. So that way, I'd say we reached a point where how then can we work with government? And that includes the budgeting, that includes giving them the data, that includes telling them this is the cost of gender-based violence. That includes, for example, the GBVRC spaces I talked about, the 13 going to 14. The next one should be in Baringo in a month or so. Being able to go to those spaces and say, this is how it's done. This is what we can do together because you have the resources. Going to county assemblies, I'll give you an example of Makueni, where you'd go and tell them, this is what gender-based violence is. Sometimes you have to start the conversation from those spaces, and not just for government. Government is made with us people. So even for our workspaces, even for corporates, even in schools, to the public, and just letting people know what is gender-based violence, letting them understand, making them realize it's not to be normalized, making them understand that we all have a role in being able to address this gender-based violence. There has been strides, not as fast as we'd wish, but there has been strides when people understand. When I talked about county governments, there's a county government went to, they understood. They put 10 million for the first time, and since then they've been putting resources towards addressing gender-based violence, setting up GBV protection centers. So the government has community structures. For example, the local, they call administrative government, the one that has the ngao, the chiefs, the county commissioners. And going around the country of late, I would notice that it is then gender-based violence because of that sensitization and making people, everyone understand. They're also taking action around it and also providing security around it. Yes.
Thank you, Alberta. And I really like the way you have really unpacked on different levels. And I can be honest to say you are very fabulous. I don't understand why you're not a minister or CS for gender.
Amen.
Or women advisor for president.
Amen.
So I would
Thank
really
you.
like also to hear from this experience that you have had in the sector and expertise. If, for example, today you are to become the minister of gender or women advisor for the president, what are your priorities that you will say as Alberta, because I've seen the gap in this and this, that I'll prioritize and put on more budget?
Medical treatment for survivors and psychosocial support. Work around and making, having, would I say, centers that work. So it's not just about putting money. It's having a response mechanism, a functional, timely response mechanism that's comprehensive.
And why is that important?
That's important because when you seem to be serious, people know that they should not joke. So I'll give you an example. There's a time I was in Kigali and people had this habit of touching women in public transport. It just took the president to say one statement in a lunch hour news and that stopped. So it's about making sure that you have the right response mechanism. You have a system that's functioning. If it's education, girls have the right education. If it's laws around marital laws and all that, it is supporting women because you can't have a team with half players. Women have to be at the center of it. making those women and girls also have the voices. So putting them also in leadership positions and in these different spaces, and not for the sake of numbers and not tokenism. Those for me would be, would I say, my priorities. Putting the resources to be able to support women and men, of course, and just have a real true balance in terms of equity, but also a lot of sensitization to that community and hold people responsible for their bad manners. So that's also not happening.
You know, you make me also think also being part of the End Femicide movement in Kenya, when you say when Rwanda president was able to speak around lunchtime news and say GBV stop or stop touching women, and it worked. But looking where we are currently in Kenya, where we are seeing our own president who says, oh, I'm going to protect women, or I'm putting a task force, which also you are the co-chair, and seeing more cases rise instead of reducing. Do you think there's a clear political will, if you feel you're comfortable to us about it?
There is a clear political will, and he's yet to get, would I say, the report. That's what I know. What we also, then that's what I think. What we've also failed as a country, and would I say even ourselves, you and I included, is the family value. We forget that all these things that are happening start at the home. I find like there's a lot of disrespect to human values, disrespect to, because we've tolerated gender-based violence, and we start then to shift the blame, and that's my thinking.
I know this work is tough, and it can take a toll to anybody who does first responders work on GBV, because there's what is written in the paper in terms of prevention, there's also in terms of response, but there's it's connection. It's very intimate work, even from what you have explained. I would really love to understand, even for you, what do you do for your self-care to be able to have the energy you have and do the work you do, but also for your team. Yeah, what do you do for wellness or well-being? Because there's this assumption we're all okay, but clearly this work is also very personal.
Yes, it's very personal, and I agree with you. And we never take care of ourselves. I must mention that the work doesn't stop. I'm sure even when you travel, you got calls about there's this case, so we need to do this.
Yes.
And people think it's just like the other jobs where you'll take leave and go. Yes, you'll take leave and go, but you still work.
Yes.
Or you'll switch off your phone.
Call.
No, you won't switch off your phone. You'll pick your call, and everyone will look at you to be able to respond. So what do I do for myself? I listen to music. I love music. Totally love music. If I'm working out, if I'm taking a walk, if I can blast music in my house at 6 a.m. and dance to it, and I'm very good at music to the point of we go for family parties and I'll be like, DJ Wamalia, and I'll make people dance the whole night. So that's one. Two, I lift weights. So I lift weight in the gym, and that I find to really be able to excel, just to remove all that pressure. I must say, Mwikali, that also for the kind of work that we do, you have to be very self-aware. It can crush you very easily. It can make you be a monster very easily and make you very numb, like you don't care about a lot of things and a lot of people. So that self-awareness is also very important, to know when to take that break, whether it's a 15 minutes break, whether it's a one-day break, whether you can't leave the house, and to also be able to understand sometimes when the psychosomatic diseases hit you. Times you wake up and you have a migraine. The times I've had migraines for months. The times your lower back is just aching and things like that. So that's important. And also who you spend your time with, when you're not working. A lot of times I meet people, I can't stop it, but someone will tell you, oh, now tell me about your work. I don't want to talk about my work that I've done for the last 24 hours. So just meeting these people like yourself who can tell me, Twende Luo Festival, eh?
And we are going this weekend.
Yes, we are going this weekend, you and I both, being and Luos, but we're together. So that's one. What do we do for our team? We have personal therapy. So we have therapists, we have psychologists from outside. We'd have one-on-one sessions. You cannot pour from an empty cup. You cannot, you have to deal with your own issues. Let someone comes for therapy and you're like, hey, umechapwa, let me tell you, mine is even worse. No, you have to be there and empathize for the other person. So we also have group supervision for the psychologists, the case managers, social workers. And once a month, then they'll meet an outsider and they'll discuss now from a technical point of view. This is how I dealt with this survivor, of course, in a confidential, no names, no what, so case management. What would I have done better? What did I need to do? These are the challenges I'm experiencing. What are these new theories? So that's also part of it. The last one then we also do is debriefing. So as a team, so even if you're an accountant, for example, you're going to see 350 invoices. You're going to see supporting documents maybe for another 150 because they've come for follow-up counseling. You're going to read there that a 3-day-old was sexually assaulted. You know, you're going to see how a lady was chopped off their hands. You're going to see how a man got his penis chopped off. And those are things that we've seen. So how do you, even if it's documentation, it is real and raw. So then as a team would meet and also then address secondary trauma, address burnout. On top of that, you also have a relationship where it's easy for you to call your colleague and say, this is what is happening to us. Just last week, we had a session at the call center. So we have a call center at the hospital. And it didn't even hit us that they're very traumatized, you know, and they're like, what do you do? And it's how affecting them. And it's affecting even how, for example, they're becoming overprotective of their kids. It's affecting their relationships. So that's what we do. And randomly, which is important.
Yes. And that also now comes to my, I think, two of my last question. We are seeing with the current state where geopolitical climate is causing also an impact on funding on gender, justice work or gender equality work or women's rights or human rights in general. Maybe from your own perspective and seeing that now we are heading to election in Kenya, and I know like for us, our elections period is usually like almost every day after an election, we start campaigning. You said cutting funding, now heading to election. Do you see any risk on how it can affect the work and the investment that you have already done on prevention of gender-based violence and even femicide?
Yes, with a lot of insecurity and this campaign mode that we are in, there's lots of gender-based violence cases. And we've seen it a lot, you know, either through intermarriages, either through, you know, ethnic clashes, you know, tribalism. And that general insecurity has also then put women and girls very vulnerable. So that has happened. That includes the timeliness of getting the services. So we tend to get late presentations. So that means you're not able to get medical treatment within 72 hours. You're only able to get it after. So you're already, for example, either pregnant, HIV infected, you know, the manifestations of gender-based violence. The psychological also trauma around it. You have heated, tensed homestays or families. You know, there's a lot of tension around it. Again, what we also see when there's a crisis, a political crisis, is that the women and girls, men and boys, their needs tend to be different. So you could be abused, you could be raped, you know, but you're not seeking medical treatment at that point. Because the other needs, I need to go maybe to my shags, I need to make sure I have food, or I need to go to this comfortable, you know, safe space. By the time you're even thinking about, I need to go and get medical treatment, that becomes a problem. So there's a lot of stress around this period, affects people economically. Of course, there's a link between poverty or economy, for example, and gender-based violence. So there's a lot of stress also around it. There are times when you have then disruptions of school. So that also creates a problem. You have, even now, let's talk about Mandamano that has happened this year and from mid last year. As late as, is it a month ago? Someone was posting how women are being undressed to get their phones from their bras, you know, and being touched funny, you know, I mean, it's sexual harassment or even rape cases and things like that. So it's already happening. That's what I wanted to say, that the electoral period is not just around just that time for elections. It's the building up to that election and the after. And you can also see a lot of disrespect going on. I won't go into details around women, even with this campaign mode. Yes.
And even across the East Africa, we have seen like sexist remarks targeting duty bearers from also other duty bearers, but also not being taken seriously, should be taken seriously.
Being normalized.
Being normalized, which is not okay. And also like the fact that you're saying, yes, we are stressed, this is the lived reality. However, I know so you work with Danida and other partners. What are these stress maybe also for institutional leaders that you're going through in terms of ensuring we get more resources to support? Because the cutting of funding is cutting. We have seen money being moved from human rights, gender equality to trades, to military, instead of money being put in the institution, like let's say GVRC. So what are the plans that you think other organizations as yourself should prepare in order not to let them die? Or let them not continue doing the work that they do? Or even what's your message to other funders that fund the work that you do so that they know why it's important to continue funding?
It's been a progressive, progressive work. I must say, where we are today is not where we were 10 years ago. And it is progressing very well. So we cannot put a stop now by stopping the funding. You know, when you're almost hitting that goal and then you stop the funding, it's just regressing in terms of gender equality and the steps that you're making. It has to be sustained. You cannot, for example, change norms overnight. It has to be sustained. That's one. Two, I find it very systemic that it's intentionally being done so. So we should continue engaging right from making it real. So is it that data? Is it that raw experience? Because when we say in a humanitarian setting and gender-based violence, it's about the numbers. That particular experience, letting people understand, working with that media, working like the work that you're doing now, being able to have this conversation so that people can listen and understand. People can listen and not normalize it. You know, people can understand what exactly are we destroying. We are destroying our community. We are destroying our people and things like that. Three, diversifying funding. Diversifying funding and holding people accountable. So if it's government, let them understand that we need people. Let them understand that we need those theaters. Yeah. If it's national funding, social, it's called SHA, Social Health Authority, yes, have a component of gender-based violence. Gender-based violence is in the emergency fund. We try to push so that then we have it beyond the 24 hours. We put everything in place. I don't know if it's too late, but we'll keep pushing. Having those survivors of gender-based violence being able to go to that system. Influencing, so working within those government structures. If it's the health education, for example, have a curriculum about it. If it's the churches, talk about gender-based violence. Let's be real about it, you know, and not have it as a taboo. And all those other spaces, you know, and not creating that bystander attitude. If it's resources, as of 2016, it costed Kenya 46.1 billion. From a study the National Gender and Equality Commission did. We need to do an economic study. What does it cost us today, including the lost opportunity for the same? So diversifying funding, I must mention, for example, Gender Violence Recovery Center does wellness program for corporates. And we're able to charge, and that money is able to come to the center and support survivors of gender-based violence. So also creatively having, you know, what do they call, synergies and alliances with other organizations. You could be good with the human rights community work that you do. It could be good in the response. How we able to come together and look for different partners to raise resources. So just keeping it creative.
And do you think male engagement is important in ensuring that you prevent GBV?
Yes, it is important. At the center, 10% of the survivors are men, and then they go all forms of gender-based violence. So that's approximately 400 survivors in 1 year. At the same time, at the center in Kenya, 90% of the alleged perpetrators are men. We are in a patriarchal society where the resources are manned by men. So bringing men as allies, not as you're the rapist. Of course, when they rape, we'll call them out. Yeah. But bringing them as allies, let them understand. I feel that men are not organized enough. Men are not being mentored. And that's why you have, I won't even go to that conversation, but that's how you have men right now who are not responsible, you know, who are not, that positive masculinity. Is not there. Yeah, it's there in a few, of course, but it's not there. So that then we need to bring it back. Men, of course, being the leaders,
And calling out
to
their
mentor
fellow men.
men. Yes, to
Yeah.
mentor the boys and call out their fellow men. But even us working with men, because when you go, for example, to the religious communities, the men who are leading. When you go to the Nyumba Kumis or the village elders, it's the men, custodians of culture. You know, when you go to our workspaces, when you go to, so how can we have this conversation for men also to understand that we are fighting gender-based violence together? We're not fighting women. Yes.
I just feel like I will need the whole day to listen to you because your wealth of experience, the wisdom. So as we close out, Alberta, I know most of the time we don't celebrate the work we do.
Yes.
I just want you to brag a bit and celebrate yourself for something that you feel this is one of the achievements that I'm happy as Alberta through my leadership or through the movement here in Kenya on ending violence against women and girls, that we can say we must protect this. Mm-hmm. Or we must hold into this as a success story, as a movement.
Wow. Not by me alone, but by the organization. I'm very proud of the center having supported over 65,000 survivors of gender-based violence from just the 8 centers. And that's just them, but also their families, so there'll be many more. I'm also very proud for the center having supported over 180,000 survivors through the emergency response program, the ones I was talking about, elections and all that. Very proud of the center also being that center of excellence, despite, you know, and the team and the leadership, the board of trustees, despite all the challenges.
Yeah.
When you're talking about volunteers, I actually forgot. My board of trustees are all volunteers. They don't even get fuel. They won't get anything. The most they'll get is tea in a board meeting, but they're always available. So really proud of that. At a personal level, I must say, Mwikali, I am proud that I've been able to have a family and have kids. Being in this space and this work, that's
not a joke.
Not a joke.
So demanding.
I would have given up on some of those things long time ago. So yeah, you see how hard it is to brag and to be proud.
No, it's important
But,
so that also we are firm for who we are and the work that we've been able to achieve.
Yes.
Yeah.
Yeah, so being that thought leader, being that person who governments, colleagues, peers, you know, young women, you know, would come and say, and I must say, there are women I have mentored, not by choice. They would come and say, you have to mentor me. And just looking, for example, how some of the organizations didn't even have a board or didn't even have policies or didn't have, and now they'll call you and tell you, you helped us shape this, and now we're helping girls in Busia, and we are getting our next fund and our next fund. So those have been wins.
I'm so happy. As we wrap up, Alberta, thank you so much.
Thank you, Rachael.
And I really appreciate that you brought very important aspect that I would like maybe our viewers to be able to look into, read, especially the public. To end gender-based violence, social norms has to change. It's not like a matter of 6-month program or 2 years, it's a long-term investment.
Yes.
There's the importance of volunteerism, which is also part of African philanthropy.
Yes.
There's also a part of also like collective organizing, which is key. Funders filling in the gap that even USAID and the rest have cut to ensure the work is moving. The numbers you have given, they're very shocking. However, important that you've been able to respond, but these are lives.
Yes, those are lives.
We can't put our life into statistic. However, we need data to be able to advance the cause. So as we close, thank you so much. Keep on doing what you're doing.
Thank you, Rachael.
And we celebrate and appreciate the work of also GVRC.
Thank you so much. Thank you for having me.
Yeah. Thank you for tuning in. I'm looking forward to see you for the next session or next episode for Human Rights and Gender Equality episode. Thank you.